Thank you, John. By the end of this week, COVID-19 vaccines may be available for children as young as 12. A federal advisory committee is expected to recommend use of the Pfizer vaccine for ages 12 through 15. This vaccine is already in use for those age 16 and older. Local health officials hope to get kids vaccinated before summer sports and before the start of the next school year. Larry Collins is following this next phase of the rollout and how North Texas is preparing for it. Larry, good morning.
Good morning, Deborah. Yeah, North Texas health officials have been working since last week for the possibility of now adding 12 to 15-year-olds to their vaccination plans. They talked about the possibility of adding additional staffing at existing hubs, talking about in some counties adding additional hubs so that folks can go and get vaccinated. Over in Tarrant County, MedStar says they are also working now for the possible influx of these children and teenagers.
And because of our flexibility, we can administer, the Pfizer to the pediatric or adolescent population. And then we can also use the Moderna that we have, which we have plenty, and do their parents. So we can do a 2-for-1, and we can operationalize that and take care of an entire family if they show up.
Yeah, MedStar has held vaccine clinics since the vaccines were made available. They have that ultra cold storage that is needed for the Pfizer vaccines, and they have the capacity to hold more Pfizer if needed to host clinics as this expansion happens. That is something of note because not all pediatric facilities have that. For instance, Cook Children's Medical Center in Fort Worth said they will refer their patients to another provider because they simply don't have that cold storage capability for the Pfizer. MedStar, they've served as vaccine providers to make sure that groups of people don't fall through the cracks. Now, because they have mobile clinics, they're able to bring the vaccines to the community. So, say if a summer sports league, vacation Bible school, summer camp, or school district wanted to host a vaccine clinic for those who are 12 and above, MedStar may be useful.
We had different operations in churches, community centers that were extremely successful. Vaccinating 700 to 800 people at a single site because we've got the ability, to mobilize, and we've got a small scale that we could travel with. All of our stuff is already packed. We're ready to go.
Now, for some parents, there may be some additional peace of mind knowing that there may be a vaccine clinic that's run by trained paramedics. They'll be there to administer the vaccine and also be there to watch the kids for any possible reactions. Larry Collins, NBC 5.